Hi, everybody. Welcome to my presentation on my agency. So, my agency is Horizon Village. I'll start by telling you a little bit about the agency. So, Horizon Village is the rehabilitation branch, the residential rehabilitation branch of Horizon Health Services. Their mission, straight from the website, is Together for Recovery, changing lives, saving lives. And they also have on their website, they believe that recovery is possible, and individuals facing substance use disorder have the right to the highest quality of treatment. So at the top there, it says Horizon Village. It's the campus in the original building. So when Horizon Village was first built, it was just this one building that you see at in the pictures there. It has since expanded to three more residential buildings and another building, this fifth one, that I'll get into a little bit more in depth later. But that's called the Wellness Center. But so all those buildings house people. Each building houses about 25 people. HV, the original building, is the largest. It serves 50. Uh, HV serves adults only, and those who identify as male. The other buildings serve different populations. So there's one that serves those who identify as women. The other three all serve people who identify as male. Another building serves young men. Another serves older men uh, and or veterans. And HV is kind of a cross section of the men, but it's only men. There's no co-ed buildings. Um, so HV provides group and individual sessions. There's no specific approach that's mandated to use on campus. So that means that groups range from CBT, trauma informed, DBT, and others. And clinicians are allowed to use whatever they're most comfortable with. They just have to remain trauma informed and person centered, but essentially they can use whatever they would like to. Motivational interviewing is another very common approach that you'll see on campus. So, in addition to the groups on individual sessions, they also have family program. Family program gets patients' families involved in their treatment. Every client has a one-on-one counselor that they'll receive treatment from in individual sessions, and the groups are ran by the counselors. Every counselor runs at least, I think, two or three groups, and they rotate throughout the week. So every day there's new groups and family programming. Getting back to that, is a way for clients to have their family members either come visit them on campus, take them out through our pass system, or to get um, time to see their kids, perhaps. And it also gives, I'll get into it a little bit more later, but also gives education to their family as well. Nursing staff are on site to help with any sort of physical care that the clients need. This can be anything from their daily medications, which nursing will distribute. That can be mental health meds or medically assisted treatment meds, such as Suboxone or methadone. They can also help them get linked up with primary care providers, as well as dentists, optometrists, really anything that can help them get linked with that. There's also psychiatrists on campus at that fifth building I mentioned, the Wellness Center. That's where the mental health providers are. And it also doubles as an outpatient clinic. So Horizon Village is, like I said, the residential branch of Horizon Health Services. There's the bigger branch is the outpatient services, and the Wellness Center on campus is one such branch. There's psychiatrists there that will help assess our clients, and they can get them prescribed mental health meds, such as hydroxyzine, propranolol, stuff like that, to help manage some of their mental health distresses. And they can also prescribe those substance abuse treatment medications, such as Suboxone and methadone. They can get prescribed, or not methadone, but Suboxone. They can get prescribed from there. There's also vocational, financial, and educational services available on campus. Vocational can help them in a chosen career path. If they want to get more into that or continue on with something, once they leave treatment, they can start the process while they're there. Financial helps deal with insurances, help pay for treatment, deal with social services, any benefits that they're on, such as SNAP or food stamps. There's also educational services that are available on campus. So if clients want to work toward getting their GED, they can do that. Doesn't cost anything to them extra. They also do college prep courses a couple times a week if they are interested. Overall, Horizon is governed by the disease model and the systems theory. To start, the disease model of addiction states that it kind of exactly what it sounds like. Addiction is a disease. It's different than the free will or choice theory of addiction or model of addiction. So in the disease model, it says that disease is a chronic illness and there is no cure for it. So from that perspective, Horizon then helps clients manage the symptoms of this disease. So they'll help them manage their triggers for their substance of choice, as well as their cravings for it. Particularly at Horizon Village, you'll see the family systems approach being utilized. That's most evident in the family program and in our PASS system. Visitation is also kind of part of the family program. So twice a week, patients, loved ones, whoever that might be, significant other, family member, whatever, they can come to campus. And they have to come at least twice a month if they want to take the patients out on pass. And what happens at family programming is there's a group that's just for family members that lasts 1 hour. It's on Tuesday evenings and Saturday mornings to kind of give some more opportunities. If people work late, they can't make it Tuesday night, they can hopefully come Saturday morning. And the group kind of gives families some of the tools that their loved ones are receiving while they're in treatment. So it can help educate them on topics like better communication, more effective communication with their loved ones, just to kind of give them a look at maybe what their loved ones are going through and kind of help them deal with it too, because it impacts more than just the client, which is part of the systems theory, right? It impacts all parts of their life, and that's true, especially for their family members or for those who are around them, maybe during the worst of their addiction. And then there's also the visitation in the second hour. So family programming is 2 hours. First hour is that group, and then the second hour is visitation. If they don't want to leave campus, if the client feels they're not ready, if their family doesn't want to take them out for whatever reason, they then at least have an hour to see whoever was willing to come. And if they don't want to take them out, they can just come for visitation. But if they do want to take them out, they have to come for the group. There's also collateral sessions, which are a more private kind of version of the family program group, where it's just between the patient's counselor, the patient, and their family member or family members. It doesn't have to just be one if both their parents want to come, for example. But that can be used to in a similar way to the family program group. It can provide education to their family members, and it can also be an opportunity for some patients to rebuild or repair some relationships that might have been damaged during their abuse. So it's just another opportunity to view the person, the client, through the lens of their bigger environment, right? So their systems. So this particularly gets their families involved and can help them a lot in their recovery journey. So for the target, I have HV looks at the impact on trauma, right? So they look at what role trauma plays both in the patient's addiction and in other areas of their life. Horizon, uh, kind of when you're looking at trauma, you're looking at what the person has been able to process, what they have and what they've repressed, and how that ties into every part of their life, right? It's not just their work or their family, it's everything at the same time. And it looks at how trauma can help keep a patient perpetuating that cycle of addiction, how it keeps them stuck in it. Where when you're not processing these traumas, when you're not dealing with your mental health, right? When you're not taking care of yourself, then you're providing more opportunities for these internal frustrations leading to, hey, I don't have a way to cope with this because I'm not coping. So they lean on their drug of choice, and that might lead to them eventually wanting to stop. But if you're not dealing with the underlying trauma, it leads you right back into, hey, something comes up that re-traumatizes you or re-triggers you, then you're just right back using your drug of choice. So the target is trauma, what impact that has on individuals, particularly in their substance abuse. And this is addressed in a variety of ways. So it's both in groups and in individual sessions. Horizon offers these specialty groups called Seeking Safety, and then a anxiety, depression, and grief and loss group. And starting with Seeking Safety, that is a specific trauma group. And it looks at PTSD, and it looks at it in a very wide lens. So it's not just looking at the mental health impact of it. It also looks at the physical aspects of it, kind of the science behind it, how it activates patients' fight or flight, what it does to your brain, what are the physical reactions to it, those kinds of things. In addition to, the ways that that manifests in yourself and your feelings and things like that. So it's a good way to help patients kind of process that out or begin to understand their trauma more. Then the anxiety, depression, grief, and loss groups are a little more straightforward, help patients understand anxiety better, um, learn more about what their symptoms are and what management looks like, what works for other people, things of that nature. Same thing for depression and grief and loss. Those are all groups. In sessions, particularly the most, I think, trauma targeted approach would be EMDR, which is a more specific approach under CBT. So it stands for the eye movement desensitization. Sorry about that. Reprocessing. And what that does is it really helps patients reprocess in a very intense and direct way their trauma. And there's been a larger push toward getting more therapists trained in EMDR. You have to be specifically trained in EMDR to use it in a session, but I'll get into that in just a second. But that's another way that Horizon Village is managing trauma or treating trauma. So the literature says, talking about the brain disease model, first of all, it talks about how it is in this article, Ricardo et al. 2023 talks about how it can be particularly effective at reducing the stigma around addiction. So this was a first-hand study of over 200 participants, and it started by educating them on what the brain disease model of addiction is, and then it asked them, if they agree with it, if they don't agree with it, gauge their opinions on it, and from there got them to look at, okay, do you agree more with punitive measures or more harm reduction measures? And it found that after being educated on the brain disease model, more people were more willing to accept a harm reduction approach. And Horizon itself, as a company, actually takes a harm reduction approach to treatment. So, harm reduction is different than just abstinence because it's kind of like what sex ed, right? So, abstinence is just saying don't use anything, use use no drugs, don't take anything. Harm reduction is kind of more realistic, where it knows that not everyone is in a place of dealing with their trauma, perhaps, or simply not in that cycle of addiction where they're ready to stop cold turkey for whatever the reason might be. And harm reduction just wants to minimize the risk of the loss of life, more or less. They want to keep people as healthy as they can be. So that's stuff like clean needle sites, access to Narcan and fentanyl testing strips. Horizon provides free Narcan, free fentanyl testing strips at all their outpatient locations. And we also provide it in the rehab. We'll give it to patients when they leave. We give them fentanyl testing strips. And that combined with the brain disease model is all designed to reduce the stigma and reduce the overall risk of human self-destruction, right? Human death. We don't want people dying when they don't have to or getting diseases when they don't have to. And the brain disease model is an effective way of reducing that stigma around that. Other articles, such as Wayne et al. 2017, they talk about how there are some positives with the brain disease model, of course, with reducing stigma, kind of bringing about just a general overall harm reduction. But there's still some positives that can be had from the moral and free will models. So, which I thought was very interesting. Really, what it comes down to is some people find the disease model, some clients find that it can be a little unhelpful because they feel like they don't have any room for growth. When you call it a disease, you're saying there's no cure for addiction, that you're always going to be an addict, that there's nothing you can do, that no amount of treatment is going to cure you, so to speak. And because of that, some patients don't like that. It doesn't work for them because they think, oh, then what's the point of doing anything? And that article kind of teased that out and said, well, if you think, from a free will choice that you are able to change, that can be more conducive to a growth mindset and more recovery. And Bolos et al. 2021 similarly noted how there's no one specific right way for addiction treatment, and an integrative, open-minded approach, more person-centered, specific to clients, can be the most effective way. And really, what the article at the bottom there is talking about is, things like CBT and whatnot. How there's no one right approach for treatment, but if you keep an open mind, you're willing to look at what works for the client, find that out, and do what works best for them. That can be really the most effective way. Some recommendations that I had. Horizon actually does a lot well. I found a lot of stuff that I would have recommended if if they're actually doing it, but this is what I would say. They do use peer review tools, or assessment tools such as the PHQ-9, the GAD-7, and this lethality scale, the Columbia Suicide Severity Rating Scale. They use those to measure depression, anxiety, lethality, the mental health of the patients. And they do that. I didn't know this at the time, but now I do. They do it at least once a month, and sometimes they're actually starting to increase it more. They'll do it once a week to gauge how clients are flowing through treatment and make sure they're keeping an eye on those mental health symptoms. As well as they also do, I don't have it on there, a brief craving scale. They'll do that whenever patients report cravings to make sure they're managing those, dealing with those in a healthy way. They're also currently expanding EMDR therapy. They're getting more therapists trained on it. Within the last year, they've trained, that I know of, two therapists in it. So now there's three total who are trained to do it. Whereas in the previous 4 years I worked there, there's only one therapist who was trained in EMDR. So they've put more emphasis on that, which is, I think, very good. And they've also have this clinical service team, which has created this committee where they actively look at peer-reviewed research to see what best care strategies can be for treatment, and then they try to implement what they find in the community or what they find from these into the programs. What they're looking at right now is the correlation between participation in the family programming and overall success. And I think that that's really good. I think that really ties back into the family systems approach and how they want to really lean into it and get patients more involved that way with their support systems and generally try to do more of the most right thing by the patients and increase those positive outcomes. And finally, they do have follow-ups in place, both throughout treatment and after. During treatment, they'll have a perception of care survey clients do to try and figure out how they think treatment's working for them, what they think isn't working. They'll do that as well when they leave treatment. They'll do another treatment assessment scale, and they'll take this feedback. They'll revamp groups if they need to, implement more trainings and such, like, for example, with EMDR. And I've really seen them implement this. They actually have just recently changed the group schedule, taken away a couple of groups, added some more to kind of reflect the feedback and the research and make sure that we're staying up to date and doing what works best for the clients. And I think that's really well, uh, does really well to serve the clients. We also will do check-ins once clients leave treatment, which I think is great. Would definitely recommend maybe expanding that a little bit. As I know now, we do just one, but maybe doing more than one. At the moment, they just make sure that they linked with outpatient, but maybe 1 month out and maybe 6 months out in addition, just to make sure clients are keeping up with everything. And other than that, I just have my references. So that's Horizon Village. Thank you for listening, and that's all.